What brings us here? To this place with the coldest winters and hottest summers? We don't come here to retire. We come here to live, to be challenged, to be inspired. This is a city that demands fresh thinking and duly rewards it. If you can make it here, well, you know what they say. We New Yorkers, we're always pushing ourselves to be better. No wonder this city gives us the best of everything. You don't have to look far to see it. It's all around us. The best food, the best music, the best medical care, the best train station. At NYU Langone, we're collaborating on every level to be the best we can be for New Yorkers and for everyone who seeks our care. After all, we're New Yorkers too.
Hello and welcome to Women's Health Watch, a show brought to you by NYU Langone Medical Center. I'm your host, Dr. Eva Kosta, cardiologist at the Joan H. Tisch Center for Women's Health at NYU Langone Medical Center, and I will be sharing some very valuable information about your health. Today's topic is cardiology, and my special guest on this episode is Dr. Adrianne Mellos, who is with the NYU Langone Cardiovascular Associates located in Astoria and Bayside. It is so important that we offer our viewers an insight on cardiovascular health issues for women. Women, for some reason, do not believe they might suffer from cardiovascular ailments other than later on in their lives. However, we are here to discuss how prevention is the key to longevity and a disease-free life. Welcome, Dr. Mellos. Tell us about yourself and tell us about your practice.
I'm a cardiologist that has been practicing for the past 10 years in Queens, primarily in Bayside and in Astoria, with Cardiovascular Associates of New York. It's a big practice, about 13 to 15 cardiologists at a time. And my focus is primarily general cardiology, non-invasive cardiology, meaning echocardiography, stress testing, and vascular workup. And we're very happy to be part of NYU and to be part of a big family, especially being here today discussing women and heart health. And that's about it.
Do you think the women patients are as aware about their cardiovascular health as the male patients?
I don't think so. I think it's a big gap in knowledge between women and men, the way they approach their health in general, cardiovascular health in particular, since we're involved with that. And I think it's very important for us as physicians to increase awareness about their cardiovascular health, and also have our women patients being more in tune with their heart health, and especially prevention and obviously diagnosis and treatment.
So we've heard more about initiatives to make women aware about heart health, such as the Go Red program. And what do you think is prompting that awareness and pushing women to be more aware that we're going to die mostly from heart disease and not breast cancer or ovarian cancer, which of course is also very serious?
Right. It's a big initiative. It started when I was actually graduating from my fellowship in 2004, a big initiative with AHA and women cardiologists. Back in that time, we had started focusing a lot on women and heart health because there was so much disease in the women population that was not diagnosed. There was no prevention almost at all. Women, as patients, ignored their symptoms, ignored their risk factors, and obviously their disease. And physicians as well at the time had most of us had no clue that especially young women can develop heart disease and can die from it. So back then, AHA sort of brought up that big campaign about Go Red for women, and it has been a big impact on women's lives ever since. There has been a drop in women's cardiovascular I wouldn't say just death, but also disease in the past 10 years, but not as much as we want it to be. So the awareness has to be there, and we have to work harder on it.
So what are some statistics when we need to about heart disease?
I think because we always think about breast cancer as 1 in 8 women, especially in New York, will get breast cancer. I think a big number that I came across is 1 in 4 women will die from heart disease, and they die from heart disease even today, even after all that awareness has been increased. There's about 500,000 women that die every year from heart disease, and this is in developed countries, especially just like ours. So I think those are numbers that ring a bell and make us think that this is the number one killer. It's not just the number one killer in men, it's the number one killer in women, and we need to focus on how to prevent it and how to be more aggressive in treating it, even when we diagnose it in women.
So at what age should we tell them to start being careful and look for the warning signs of heart disease?
I don't think there is an age group. I think we should always think about our risk factors and know what our risk factors are as women in adulthood, in their 20s even. We should be aware of our risk factors. We should know what brings us closer to heart disease, what makes us, what increases our risk for heart disease. So there's many of the risk factors that we can start, we should start thinking about what our blood pressure is. We should know our weight and what the goal of our weight is for any age group. We should know our cholesterol numbers. We should know what those numbers are and why there's a goal there. There are certain numbers that we need to be aware and how to lower them. And other risk factors, and let's not forget also, younger women can develop heart disease because there are specific risk factors for those women as compared to older women. That the classic risk factors. After menopause, you are going to have a higher risk for heart disease, and it exponentially increases as compared to men. So there is no age group.
Smoking.
Oh, smoking, absolutely. So there's a lot of risk factors we can talk about, but the bottom line is there's no specific age group. Pregnancy, women have risk factors during pregnancy for heart disease, and our awareness is higher now that we know that women that have hypertension during pregnancy or diabetes during pregnancy, they can have a higher risk of developing these conditions as they, they're not, after pregnancy, and that increases their risk for heart disease in the long run. Autoimmune diseases, much more common in younger women. We tend to forget about them, but they do raise the bar for heart disease in many different levels, coronary artery disease, obviously, and heart attacks. So,
Okay, so let's talk a little bit about the symptoms between men and women, the difference. I mean, most men and women will get pressure, chest pressure, left-sided chest pressure, nausea, sweatiness, shortness of breath. The common symptoms are common between both men and women, but women will get other symptoms as well with heart disease. So let's talk about that a little bit, how we differ from men. We are similar to men in many ways, but we're also different.
Right. I believe that obviously chest pain is similar to both sexes, as you mentioned, but there's many different symptoms out there that we ignore, and the patients ignore, and us as physicians sort of tend to ignore. Just a generalized discomfort in the chest area. It might not be specifically on the left side of the chest. It can be everywhere in the chest. It could be in both arms. Women can feel sort of fatigue and tired. That could be a sign of a heart attack even. It might not just be a sign of, the beginnings of coronary artery disease. Shortness of breath, or just being tired, not being able to walk the usual, distance that they normally walk. Nausea, sort of nauseous and feeling stomach upset, and primarily, you can have the symptoms of sort of discomfort in the middle of the chest or in the belly, and you can still have, heart disease related to that. Most of the symptoms, I think, are, and again, emotional distress means a lot of women think they're stressed out, they don't feel well. Even stress for an emotional situation can really be part of a presentation of a heart attack.
I've had some strange presentations. I had 2 women present with heart disease. One got a stent, one had a heart attack, and their symptoms were, I felt my bra was too tight. And when I loosened it, my pain didn't go away. But they knew enough to come in and say something was different, and they paid attention. I had one woman who told me I was too tired to get off a train. That's how I knew something was wrong with my heart. So you just have to pay attention to changes in pattern. People know their bodies. Yes, women tend to ignore things, but they do have some unusual presentations.
Right. Even back pain, I forgot to mention that. I've had patients with back pain, young ladies, and a lady in her 30s.
But not lower back pain.
No, not lower.
Lower back pain.
Upper. A patient of mine had a heart attack in her 30s that presented with back pain out of the blue, and a big artery, a major heart attack, not a subtle one. So it's interesting how we present differently.
Now we are going to hear from our community on how aware women are about their cardiovascular health.
I already went for one last year. I went to a heart specialist and she gave me a clean bill of health.
Once per year?
Every 6 months.
Every year.
I haven't yet. I don't think I'm old enough.
Yes, stress does affect my life and it could cause problems, yes.
A lot of it, maybe, but it hasn't done that to me. Maybe a lot of stress could cause heart problems.
You know, the tendency to eat and everything, you know, once I'm stressed, I want to like pick, and if I, I know people like they smoke, you know, because of the stress.
Smoking.
Yeah, I would like to change, you know, just maybe my sleeping patterns too. Also, you know, sometimes I stay up late, you know, and then I'm not getting a good sleep for the day, so you feel a little more stressed, you know, a little more tired, so not as active.
I mean, your lifestyle affects your health in general. The way you eat, the way you exercise. If you exercise or if you don't, all of that.
So let's address some of these questions. To the young woman, I would say, which is a quick answer, know your blood pressure, know your cholesterol level, know your genetics. I mean, what happened to your mother, grandmother, grandfather, know your genetics if you can. And do some things that can prevent you from having heart disease when you get older. Move, try to have some healthy meals per week, fruits and vegetables, just the basics, and don't smoke. For the stress factors, I mean, what can we tell women about stress factors? Yes, it could be as serious as Takotsubo disease, where you could tell us about that.
Yeah, sure. I mean, going back into the risk factors, I think it's a major point to make women aware that they have to be involved with their health, and they need to know what these risk factors are. And not only they have to address it on their own, they should seek help with their doctors. They should talk to their internists. They should talk, if they have a cardiologist, talk to a cardiologist, get an EKG. But going back to the risk factors, weight. Very, very important. Obesity is a major risk factor for women, even worse than for men. Women tend to be more sedentary than men, and they need to work on that. And we're going to talk about the ways how we can approach that. Hypertension, high blood pressure. They need to know what their cutoff is. They need to know those numbers. Again, it doesn't matter how young or old they are. Cholesterol, smoking is very important. Smoking is a very high risk factor for coronary artery disease and other, obviously, cancers and whatnot. But there's, especially in the Greek American community, there's still women that smoke. There are men that smoke, but women also smoke too. So it's a big risk factor in our community. Obviously, stress. Stress is in and itself is not a major risk factor for coronary artery disease, but it adds on to the other risk factors. So if we not looking after our major risk factors for coronary artery disease and add stress to that, yes, mental health is very important for women because stress adds on. It's an additional risk factor to the classic and traditional ones. Takotsubo cardiomyopathy, that is what we call the broken heart syndrome. It happens primarily in elderly ladies, and it appears as they present to the hospital with chest pain as if there is a major heart attack. Their heart function drops tremendously. They have what we call a balloon heart, and they don't have obstructive coronary arteries. They don't have blockages in those coronary arteries. It eventually gets better. So most of these women do recover, and they recover their function of the heart, but the stress is what brings them to that particular diagnosis. And there's women that do not recover from that cardiomyopathy, which brings on more problems in the future: heart failure, shortness of breath, more symptoms. So the bottom line is we have to work on it. They need to address it. The patients need to address it. And us physicians, we have to be more understanding of women's emotional factors in their lifestyle and how to sort of help them take care of those other risk factors by taking care of also their mental health.
I had two ladies with Takotsubo cardiomyopathies. They had heart attacks right after arguments, one at a meeting with her boss and the other one with an argument with her brother. So it's a real phenomenon, the broken heart syndrome. It's very interesting. A sudden onset heart attack, normal coronary arteries, it's stress hormones. Right. So let's talk a little bit about how we reduce stress. What can they do? We could do that after our commercial break, actually. We're going to cut to a quick commercial break, and when we return, more great information on how you can keep your heart in good shape.
What brings us here? To this place with the coldest winters and hottest summers? We don't come here to retire. We come here to live, to be challenged, to be inspired. This is a city that demands fresh thinking and duly rewards it. If you can make it here, well, you know what they say. We New Yorkers, we're always pushing ourselves to be better. No wonder this city gives us the best of everything. You don't have to look far to see it. It's all around us. The best food, the best music, the best medical care, the best train station. At NYU Langone, we're collaborating on every level to be the best we can be for New Yorkers and for everyone who seeks our care. After all, we're New Yorkers too. More than 8 million people live right here. 27,000 of us for every square mile. That's a lot of people. What makes this city such an attraction? What makes this place so cool? We take pride in saying, I'm a New Yorker, and that's the way it's always been. One thing we've all learned in recent times is that no matter what life throws at us, we face it together, and we always come through, stronger than before. We are, for the most part, good people. We come to the aid of others, willing to lend a helping hand because we care. Even though we sometimes get the impression we don't. At NYU Langone, we're here to care for our fellow New Yorkers and for everyone who needs us. That's what we do. That's what we love to do.
Welcome back to Women's Health Watch. For those who are just tuning in, today's topic is cardiovascular health, and joining us is Dr. Adrianne Mellos. Besides heart attacks, there are other cardiovascular diseases young women can have and older women, valvular disease, high blood pressure, arrhythmias. So let's talk a little bit about that.
Okay. I think there's a wide range of cardiovascular disease that women have to be aware of at any age group, especially hypertension. I'll start with that because it's a major risk factor and it's a disease in itself that requires a lot of attention from the patient, a lot of attention from the doctor. Women don't know their numbers. They most of the time they have borderline blood pressure that goes unattended. For the most part, hypertension goes untreated or less treated in women than men in general, especially younger women. And in the long run, it develops what we call hypertensive heart disease, which is leads to a stiff heart, and that leads to heart failure with a strong heart. And a lot of times it goes undiagnosed, untreated. Other types of pathologies, obviously we have valvular heart disease, mitral valve prolapse is a classic diagnosis. We see it in women and men, but in women a lot of times they present more with anxiety symptoms, with palpitations, with chest pain and whatnot, and most of the symptoms are probably related to that instead of other pathology, anxiety or whatnot. Arrhythmia, big diagnosis in women and men. I can't say there's a tremendous difference between the two, but we do have a lot of the younger women population presenting with palpitations. A lot of times we disregard that as being anxiety related, and I would say that there's more awareness about arrhythmia, especially arrhythmias in younger patients that are treatable and curable. So I think the focus has to be that palpitations should not be ignored from our patients and obviously from us, the physicians. In the realm of for coronary artery disease, I wanted to mention microvascular disease that is classic in women as compared to men. A lot of times we don't see obstructive coronary artery disease in women.
So we have to delineate with this for people. It's not the big arteries, it's the smaller arteries
ones
that go into the heart muscle itself that
Correct,
you can't see on the angiograms, so that people know what you're talking about.
Absolutely, and that's something that that we should not ignore because a lot of times they go untreated, even though we don't find blockages in those arteries that are big and that we can visualize. A lot of times, those women continue to have symptoms, and they are not being treated. We don't ignore them, but we need to understand better the pathology behind those symptoms and treat them aggressively as if they had obstructive disease.
A lot of what you said supports the argument that heart disease is not a disease of older women, that women of all ages can have issues, stroke, high blood pressure, arrhythmias, cardiomyopathies, and should get checked and should be aware. And a lot of women could walk into a pharmacy and just get a free blood pressure check and be aware of their numbers. So now we're going to talk about Greek risk factors. What do you think is particularly, applies to Greeks, cardiac risk factors besides smoking?
Yeah, I have a lot of Greek patients.
A lot of smoking, right? A lot of smoking.
I mean, in younger population, it's pretty prevalent, and we find it hard. It's they understand that it's a risk factor because it's obviously the awareness is up there, but they still smoke. So I think that from us physicians, there has to be a lot more work. More attention in that particular risk factor because they tend to just ignore it. They tend to bring it up as, I'm just smoking a cigarette here and a cigarette there. It eventually adds up. It eventually causes a lot of trouble in our arteries. So in the Greek community, smoking is still big. It has dropped over the years.
In the young community, fast food.
Yeah.
The youngsters are eating fast food now and not their great Mediterranean diet their parents had.
That's major, even though their mothers and grandmothers in the houses, so they still cook the good food. A lot of times we all agree, and the patients agree, and we also see that there's a sway away from that Mediterranean classic diet with the classic changes and your greens and your fish and your vegetables.
So what are some ways that women can reduce their risk factors? What can we tell women? Some very basic things they can do on a daily basis, because it's hard to be perfect.
I think it's crucial that that they have to understand that they are the major factor in their health. We can sit and talk all day as physicians, but they need to realize that it is very important for them to be the leader in that situation, and obviously we're going to be a big help to them. Number one, they need to know, they need to be aware. They need to be aware that heart disease is their number one killer, young or old. And number two, they need to be aware of their numbers. They need to know their blood pressure. They need to know their cholesterol. They need to know their BMI, their body mass index. They need to know that their weight circumference has to be a certain number. In women, has to be less than 35, 38, the most. I would say if we can, if we can pinpoint certain numbers that women can go by and know what they are, and they can fight them better.
And move, take the stairs,
Absolutely.
Get up one stop earlier,
so there is
walk around the block.
Exactly, inactivity.
Go to the water cooler.
And how do we change those risk factors? I mean, obviously, it's our classic diet and exercise statement, but then you need to be a little bit more specific. What do we mean by diet? I mean, something that you need to change in a daily basis, but that you can sustain and keep on doing it for, the rest of your life. It's a big change. Big changes don't come, we cannot start big. We have to start small. So, patients need support in that. All of us need support in that. We all need to think and then address the patient the same way we work, we do that for ourselves. You need to start with, cutting down the portions as far as the diet goes and changing even one ingredient into that plate that is healthier than the previous plate you ate the previous day. Add a vegetable, add a fruit, cut back on the carbs, cut back on the, fatty food. Increase your fish, increase your chicken intake, increase your vegetable intake. It's classic. There's not much more classic than that. Physical fitness. Nobody can exercise every single day of the week. Maybe some people can, but most of the people can't. You just need to add that half hour in your day. Put it away, whether it's early in the morning or late in the day. Most of these women are mothers or they work. They have a full schedule at work. They have a full schedule at home. It's very hard to take a little time away from their day for themselves.
So the American Heart Association says 30 minutes, 5 days a week of aerobic exercise is recommended for a healthy heart. Do as much of that as you can. The more, the better. At least try to do 5 if you can do 3 is very good, or 10,000 steps a day.
Exactly.
So people can get a Fitbit or use their iPhones and try to do 10,000 steps a day as many days a week as they can. So there are simple things people could try to do.
And those numbers that you mentioned decrease your risk by 50% of having a heart attack. It's great. It's a great number, but absolutely. I mean, I see that a lot. The pedometer and the women wearing that and trying to walk more. even walking.
It motivates you.
Yeah, absolutely. So those are the two major things that they should do. But then they should also go and check themselves. They need to go to a physician. They need to get an EKG. If you're a woman over 40, you deserve an EKG. You need to have a basic cardiogram that can give us basic information about your heart rhythm, about your arteries even, and a physical exam to make sure that your valves are fine, that your heart healthy, your blood pressure, your weight, your cholesterol, basic things. Everybody should get them above 40.
So at about 40 years old, we should tell women go and have an electrocardiogram.
I think 40. I mean, I don't like the cut. I never like cutoff numbers.
And everyone's different.
I would
and
not
everyone
go
has
with
different risk
correct.
factors.
But even if you're below 40 and you have symptoms, you should not ignore them. You should go and have them checked.
Okay, and time for a commercial break. When we come back, we are going to hear more from our viewers in the community.
What brings us here? To this place with the coldest winters and hottest summers? We don't come here to retire. We come here to live, to be challenged, to be inspired. This is a city that demands fresh thinking and duly rewards it. If you can make it here, well, you know what they say. We New Yorkers, we're always pushing ourselves to be better. No wonder this city gives us the best of everything. You don't have to look far to see it. It's all around us. The best food, the best music, the best medical care, the best train station. At NYU Langone, we're collaborating on every level to be the best we can be for New Yorkers and for everyone who seeks our care. After all, we're New Yorkers too. More than 8 million people live right here. 27,000 of us for every square mile. That's a lot of people. What makes this city such an attraction? What makes this place so cool? We take pride in saying, I'm a New Yorker, and that's the way it's always been. One thing we've all learned in recent times is that no matter what life throws at us, we face it together, and we always come through, stronger than before. We are, for the most part, good people. We come to the aid of others, willing to lend a helping hand because we care. Even though we sometimes get the impression we don't. At NYU Langone, we're here to care for our fellow New Yorkers and for everyone who needs us. That's what we do. That's what we love to do.
Welcome back to the Women's Health Watch, a show brought to you by NYU Langone Medical Center. My name is Dr. Eva Kosta. I'm a cardiologist at the Joan H. Tisch Center for Women's Health. We are a multi-specialty practice with cardiology, internal medicine, dermatology, gastroenterology, endocrinology. We welcome 70% women. We have 30% men, so all are welcome. We're located on 84th Street and 3rd Avenue. And with me is Dr. Adrianne Mellos, and tell us about your practice.
Well, our practice is a cardiology practice only. We have actually many locations. Our two major locations are in Bayside and in Astoria. In Astoria, we are located at the Agora Plaza, the major center in Astoria, the Greek Center, and the Bayside location is at 4401 Francis Lewis Boulevard. We offer also services in Manhasset. We have an office there as well as in Flushing. And some other offices in Queens and Maspeth and the Middle Village. Our practice offers general cardiology consultation. Also, we do have all cardiac testing, including stress testing, echocardiograms, vascular workup, including ABI, carotid scanning, and the rest of the vascular workup, legs, as well as abdominal aortas. And we have interventionalists in our practice that perform cardiac catheterization at NYU, as well as in other locations. And electrophysiology, there are specialists for arrhythmias, and they also see patients in Astoria and Bayside.
Great. And now we're going to answer some questions from our viewers. Let's hear what people have to say.
Maybe what I can do now to prevent any problems later on with my heart. like what I should be doing besides diet and exercise, if there's anything else that could be done.
Maybe later on when I get to be very old, will I have cardiovascular problems?
How to keep my heart healthy. What are the best ways to keep my heart healthy? I know that eating, certain foods is good, so I try to do that. But what are the things that I can do every day to make sure that I keep a healthy heart? Because they say, especially for women, that heart attacks are silent killers, stress and heart attacks. If you don't manage your health, if you are the breadwinner in your family, you can run a risk of, affecting your whole family just by poor health choices.
So we had the young woman ask, what can she do to maintain heart health? And we covered, diet, exercise, healthy habits. And really the trick is to make it part of your daily routine. We're creatures of habit, and if we could make it like brushing your teeth part of your daily routine, that would help. What else could we tell her?
I think as we covered the risk factors, they need to be aware of that. The young lady needs to be aware that there are things out there that can happen to her as hypertension or high cholesterol. And if she's not aware, to have that checked periodically, at least once a year, either at a local pharmacy or at her doctor, that she should have a regular checkup. That will decrease her risk in the long run. And obviously, that particular patient or lady was aware of diet and exercise, but she needs to be aware of having herself checked with a physician periodically for those risk factors I mentioned. Keeping her weight low, keeping her exercise routine up and running, and watching her diet, as you mentioned.
And one of the ladies mentioned stress. Women are now breadwinners, elder care, they're providing elder care, child care, house care. So we have to find some ways for women to reduce stress. I mean, of course, there's yoga and meditation, but what can we tell them for stress reduction? What do you advise your patients?
I mean, I talk to my patients all the time. I think just talking to them does help. I tell them they need to talk to their own friends, family members that they trust, and they can go over their stressors in their lives. I mean, they need to be aware that the stressor won't go away. There's going to always be something in our lives that's going to bring us stress. It's about knowing how to cope with it. So creating sort of a wall for that stress to not allow it to affect them in a way that can really harm them in the future. Obviously, some of these patients can deal with stress on their own. And some of them can't. So a lot of times I do refer them to psychologists, and there's nothing wrong with talking if you don't feel that you have close family members or friends that you can talk to about your stresses in your life. Then there's nothing wrong with talking to a psychologist. If your internist or even your cardiologist does not spend enough time on that direction, doesn't even have the expertise.
Meditation also helps. It's
Absolutely.
hard to do. It's hard to do because you're thinking about a million things while you're trying to meditate, but that also reduces stress.
Yes.
Right. Okay, one more thing I wanted to mention of interest. The ancient Greeks built theaters around hospitals. Ancient Greek hospitals had theaters such as Epidaurus and Ephesus, and really to entertain patients. So I tell my patients, try to do something fun, try to do something for your soul, whether you meet friends or go to a movie or something. Try to do something to lift your spirits. I think it helps in maintaining health.
Great idea.
So Dr. Mellos was telling me how her kids are asking for a dog, and I strongly support getting a dog. Dogs, as you know, reduce your risk of stress, people who have dogs live longer. They're great. They're great to have in the family. They're great for older people. So get a dog. You'll live longer and have less heart disease. That's another thing you could do. And let's talk about aspirin. Everyone asks me about aspirin. I tell my women, take a baby aspirin every day. If you don't tolerate it, take it 3 times a week because, as we know, reduces strokes in women, heart attacks in men. What do you tell your patients about aspirin, and at what age?
Right. I think my elderly patients, my elderly ladies, women more than 65, maybe even higher than that, maybe 70, 75. I hate cutoffs. I mean, there's no great recommendation out there, but I think 70, 75 and above, and with risk factors, hypertension, high cholesterol, family history and whatnot, I do recommend aspirin in women. Even younger if they have risk factors, even below 65, sometimes I do recommend it. Patients have diabetes. I do recommend it highly. There's a lot of times there's no great data in women, primarily in men. We know that men do have to use aspirin daily to prevent heart disease. I think women too. So I do recommend it highly, I have to say, and we go over the risks. If there is a woman that has GI upset or a history of peptic ulcer disease and she cannot tolerate it, then we do not use it. But in everyone that is of an elderly, above 65, 70 years old with risk factors, I do recommend it. And obviously watch for side effects such as...
Do you take aspirin?
I actually don't.
I do. I take 3 a week. I do.
But I do recommend the 3 a week too.
Yeah, I do.
To many
because
women.
What if it does reduce colon cancer? What if it does
That's
have these
true.
wonderful other
That's
effects
true.
besides the heart? So I do, and I tell my women, if you can
Yeah.
tolerate it, take it.
But I will when I grow older.
They give it to pregnant women who are preeclamptic.
That's true.
So, and
Absolutely.
they're just fine.
Absolutely.
And let's talk about one other thing.
Right.
The biggest argument I have with my patients is statin therapy. They're resistant. They don't want to do it. I want to do a diet. Oh, it's so toxic. And I tell them they're pretty well tolerated. They've had it. They've been around for a long time.
Right.
And what I try to tell my patients is the non-lipid lowering benefits of statins. Yes, they lower your numbers, but they also have other effects on endothelial function and passivating plaque. What are your thoughts on statins?
I'm a big proponent of statins. There's been great trials out there. We've had plenty of evidence over the years that for both reasons that you mentioned, not only lowering the cholesterol in the blood, but especially plaque sort of stabilization and all these other effects that it has in the vascular system. I'm a big proponent. I use it to many of my patients, young or old, depending on their levels of cholesterol, and that does not take away the diet and exercise factor, not at all. So you need to take a statin, but you also need to work hard. It doesn't mean that you can do it on your own, or by taking a statin you're going to cut off or cut back on the other methods.
So if you have a great life, so you can take less of a statin.
Correct.
But the reverse doesn't work. You can't eat steaks every night and take more of a statin.
No, it's not going to work.
It's not going to work. And what about supplements? I do tell my patients who are resistant to pharmaceutical statins, I tell them try the red yeast rice.
I do too.
It works?
I do too. It does.
I just don't know how to dose it.
Results. Yeah, there's no particular dosing. I mean, I think I just tell them to use it the way it's recommended by the manufacturer. But the truth of the matter is, it's not.
You're on your own, I tell them.
Yeah, it's almost the same thing. Just make sure you read those labels. You make sure that there's nothing there that is not, outwardly. And we go over the labels sometimes ourselves. But yes, non-statin, medications, or not medications, but even like over-the-counter things that are
But
safe.
red yeast rice is a statin. Dr. Mellos, thank you for joining us today. It was wonderful having you. I hope to see you soon. That's all we have time for today on our show. Please join us again next week on Women's Health Watch. I'm your host, Dr. Eva Kosta. I look forward to bringing you more information on women's health next week. Same time, same place on New Greek TV.
More than 8 million people live right here. 27,000 of us for every square mile. That's a lot of people. What makes this city such an attraction? What makes this place so cool? We take pride in saying, I'm a New Yorker. And that's the way it's always been. One thing we've all learned in recent times is that no matter what life throws at us, we face it together. And we always come through, stronger than before. We are, for the most part, good people. We come to the aid of others, willing to lend a helping hand because we care. Even though we sometimes get the impression we don't. At NYU Langone, we're here to care for our fellow New Yorkers and for everyone who needs us. That's what we do. That's what we love to do.